Good morning. This is Dr. Smith talking to you again from Nephrology Associates in Augusta, Georgia. And I want to take a couple minutes this morning to talk to you about something that's, I think, very important as a kidney patient, and that is how to have a successful visit with your provider, primarily your nephrologist. We spend a lot of time in our practice working to educate patients on how to be successful as a patient. I don't think that this is really addressed in any detail commonly, and I wanted to take a minute and provide some pointers that I feel are important in the amount of time that I've spent in the office and in the clinic helping patients to take care of themselves. I want to make a couple of points. The first one is this is a relationship, and so I've commonly seen patients be frustrated, be upset, say something to the person at the front desk, come back to the doctor's office, be seen, leave, and not communicate what a problem or a concern is. I tell my patients we are in relationship, and relationships have good days and bad days. Feelings get hurt, things are said that are maybe misinterpreted, and my goal with my patients is to maintain relationship, and in that, patience, understanding, and most importantly, trust has to be considered the priority. You need to trust me, and we need to trust you. Did you know that when your provider does not trust your ability to follow through with the things that we request at a clinic visit, we are not legally able to provide you with the highest level of care possible, because some of the medications that we use require a lot of trust, compliance on the patient part, and we are concerned that without those issues in place, there's a risk for harm for the patient. And so I want you to understand that when there's a lack of trust that the provider has for the patient to follow through with instructions and care that's recommended and encouraged, we're not able to commonly give you medications that can provide the most protection for your kidneys. Number two, in the same vein, we have to communicate. In today's age, there's countless ways to communicate. In our practice, we have an EMR, as do most practices these days. The EMR has a patient portal. There is a way to communicate there. There is, of course, office phone numbers. Your doctor's and your provider's medical assistant has an extension, and voicemail and immediate pickup is available commonly during the day, and voicemail is always available. There's also the opportunity to email. And so I want to encourage you to be assertive as a communicator, being reachable, having phone numbers that work, addresses that are current, emails that are functional, and allow us a couple of layers actually to reach you if you cannot pick up. What is a good phone number for the next person on your team that is involved in your care? Maybe that's a daughter, maybe that's a spouse. How can they be reached? What is their preferred mode of communication? We want to make sure that we're communicating efficiently to streamline your care. The third point would be, let's be responsible. I want to talk about the patient's responsibilities first. So everybody, when they come into the practice, has a responsibility document. Of course, in that includes who can be contacted. That is your HIPAA form. But there's also other language in there that talks about expectations. And so responsibilities as the patient enters the office and follows through with the visit and leaves, is a long list, and I understand in the time that I've been doing this that it can be overwhelming. And so what I would ask you to do is relax, communicate, tell us what you're struggling with. For example, if we talk about a medication and you're confused, say, I'm confused. If you remember it after you leave the visit, write it down, and then we can discuss it when you come back. Or if it's more pressing, call back, contact us through the methods that we've outlined, and let us know. Some simple things that will help you to be successful, and we review these things all the time with our patients. Know your medicines. Why are you taking this? What is it for? Can you tell me it? If not, have you written it down somewhere? Or better yet, have you taken a picture of it so you know what your medications are that are entering your body? What is the milligram amount? Are you able to tell me who prescribed it for you? Those things are super critical. Most kidney patients are on no less than 5 to 10 medications, and commonly more. As kidney disease advances, the need for added blood pressure medications goes up. It's not uncommon to be on 4 or 5 different blood pressure medications that act at different spots in your body because of the severity of your kidney disease. So I can't underemphasize enough, know your medications. I recommend pill boxes. Pill boxes are helpful in that they let us know when we're running out of a medicine. They allow us to get refills before we need refills urgently. Calls to the office for refills are things that I feel are avoidable, and allows our staff to focus on providing care that is more pressing. So know your medications. Bring your medications, or if you're not going to bring them, have them written down or have a picture of them so we know exactly what you're doing. Your provider will commonly give you some instructions, okay? Check your blood pressure. Keep a diary. Maybe that's your weight, maybe that's your fluids, maybe that is what you're eating. Bring that data. That data gives us the opportunity to make clinical decisions when you come into the office to give you better care. Get your labs done, okay? That's a big one. If you're given instructions for lab work, be responsible to get it done timely. If you cannot get it done timely, call us and let us know. If we are calling you, please call us back. We're not interested in sending the police to your house, but again, the staff are working to take good care of you. So again, let's be reachable, let's call back, let's not be what I would consider passive or even passively aggressive. This is your health care that we're talking about. Let's talk about your financial part. If you cannot make a payment the way you feel responsible to make a payment, communicate that to us. We, of course, contractually have to ask for co-pays. We all are responsible for our own fiscal piece to our health care, but we have means to communicate and work out payment options and plans that allow you to not have breaks in your care. I can't tell you how many patients I've taken care of through the years that fall off the radar because of an under communication regarding a financial issue. Maybe their insurance changed, maybe they lost their insurance, maybe they're just way behind and they're embarrassed. Look, we're all human. We all have struggles. We want to treat the patient as a patient, and we expect the patient to treat us as humans and understand that we are capable of mistakes just as much as the patient is, because we're all just humans. So my expectation and hope is that you'll be a communicator, not allow gaps to happen in your healthcare over preventable things. Bring family with you if you're confused. Have a family member as the contact or the point of responsibility. Kidney care involves a lot of different things and many times complex instructions. Bring someone with you that can help. bring to the table knowledge of what's happened in other offices before you come to see us. If you've seen your heart doctor, understand the details of that visit. Better yet, I ask my patients to keep their own log, their own 3-ring binder of their visits. Did you know that you can get a copy of your visit before you leave the doctor's office? Some of my more astute patients will say, hey, can I get a copy of today's visit? They take the copy. They have to wait a minute, but they get the copy, they put it in their binder, they go to their doctor down the street, and he has a copy of the whole encounter. So communication is enhanced. You be the point person for your care. You bring your provider's knowledge by having it at your fingertips. Yes, we can call the other doctors. Yes, we can look things up in the portal, but everybody is busy, and efficiency is super important. And always understand you are the point, just like I am the point when I'm the patient. The last thing I would say is don't be afraid to tell us to be accountable, okay? Too many patients have come in and out of the practice because they just don't want to speak their mind. Again, this is a relationship. I'm needing to be on time. Give us some patience and some tolerance for emergencies, but the doctors and the providers need to do their part in giving you a good visit as well. So don't feel like it's one-sided. This, again, is a relationship. We want you to communicate. We want you to be responsible. This will take some practice, but you can do it. And finally, yes, we need to do our part too. So thank you for this moment to share this information with you. Have a good afternoon.